Great. Hello, everyone. I'm Apoorva Shankar, Assistant Professor in Microbiology from the Department of Life Sciences, Christu Jayanti College. Today, under foodborne infections and intoxications, let us discuss about salmonella. Salmonella, the causative agent of typhoid fever. So, whenever we are discussing about salmonella and the typhoid fever, the one of the historical event which is very important is typhoid Mary. In the early 1900s, the woman by the name Mary Mallon was the first healthy carrier of the typhoid fever in the United States. It is estimated that 47 people were infected by Miss Mallon. Of those 47 people, three died. Mellon worked as a cook for very wealthy families. After half of the household of one such family became ill with typhoid fever, they hired investigators to determine the cause. Eventually, she was implicated as the source of illness in that household and several others. The health officials were notified, and eventually, she was detained despite much resistance. She was taken to hospital in New York where the stool samples were taken. She tested positive for typhoid bacteria even though she remained symptom free. The health department then transferred her to an isolated area on the northern border island, Brother Island, New York, where she spent a couple of years, but was eventually released. She was given strict guidelines by the health officials to stay away from any work that would involve food preparation or any type of care for people. Approximately 5 years after her release, an outbreak of typhoid fever in Manhattan, New York hospital was reported. 25 persons became ill, two of which died. It was soon discovered that Mary Mellon was working there as a cook under a fictitious name. At this point, she was recaptured and again isolated on the northern Brother Island for a reminder of her life for about 28 years. So, this story of Mary Mellon, she was a convalescent carrier, asymptomatic carrier for typhoid, and her occupation, that is cooking, was a deadly combination of two. And we can also see that isolation, she was isolated in an island for about 28 years. So this marks the very history of Salmonella. The organism, the Salmonella, which is a causative agent of typhoid fever, is a gram-negative bacilli, which is about 1 to 3 microns. It is a motile which has peritrichous flagella. The organism is known to cause the enteric fever, the typhoid fever, which is caused by different groups of Salmonella, that is Salmonella paratyphi A, B, and C, and Salmonella typhi, which causes the typhoid fever. Salmonella paratyphi A, B, and C causes the paratyphoid fevers. So there are different types of salmonellosis and syndromes which are in humans. Salmonellosis, which is caused by Salmonella coreus enteris typhimurium, which has a zoosomatic and two phases of H. flagellar antigens. So these are some of the examples of different types of Salmonella species and the diseases which they cause with their incubation period and signs and symptoms. Mostly the signs and symptoms involve the vomiting, diarrhea, and headache are the common symptoms in all the three different types of diseases. And the transmission of this pathogen is through the fecal oral route. So here we can also see that the transformation of this pathogen can be because from the wild reservoirs, which can enter into the farm stocks. So farm stocks, usually the eggs and meat products have these organisms because they can enter through the fecal oral route. And this diagrammatic representation represents what are the different sources by which the organism can reach the farm livestock. Salmonella can be spread by food handlers who do not wash their hands or the surfaces and tools they use between the food preparation steps, and when people eat raw or undercooked foods. Salmonella can also be spread from animals to people. People who have direct contact with certain animals, including poultry and reptiles, can spread the bacteria from animals to the food if they do not practice proper hand washing hygiene before handling the food. The pets can also spread the bacterium within the home environment if they eat the contaminated food with salmonella. Symptoms. Most of the people who are infected with Salmonella will begin to develop symptoms within 12 to 72 hours after infection. The illness, salmonellosis, usually lasts 4 to 7 days, and most of the people recover without treatment. Most people with salmonellosis develop diarrhea, fever, abdominal cramps. Most severe cases of salmonellosis may include high fever, headaches, lethargy, rashes, blood in the urine or stool, and in some cases may become fatal. Some do not serve as convalescent carriers and as chronic carriers of the pathogens. What who are at risk? The children younger than 5 years, elderly people, and people with weakened immune systems are more likely to have the severe salmonellosis infections. The preventing football illness at home. What are the different precautionary measures which we can use? Is always wash and sanitize the surfaces that is used to serve, store, and potentially who are contaminated with different products. Washing hands with warm water followed by soap and cleaning and sanitization processes the must. Children, elderly, and pregnant women and persons with weakened immune systems should avoid eating raw sprouts or any kinds of raw salads. People with pets should take special care to avoid cross contamination when preparing their pets' foods. And also be sure to pick up and thoroughly wash food dishes as soon as the pets are done eating and prevent children, elderly, and any other people with weak immune systems from handling or being exposed to the food or pets that have eaten potentially the contaminated food. The restaurants should also follow proper hygiene protocols and regular health checkups. The pathogenesis. The infection is usually diagnosed with a laboratory test detects Salmonella bacteria, which can be done through the stool or body tissues or fluids. The most common used test is the Vidal test, widely investigated diagnosis as a laboratory, which is Vidal. Test is an agglutination test which detects the presence of the serum agglutinins H, the H antigen, and the somatic antigen O can be detected in the patient's serum with the typhoid and paratyphoid fever can be detected. So here you have O somatic antigen, H flagellar antigens, AH antigen, which is specific to Salmonella paratyphi A, the BH antigen, which is specific to Salmonella paratyphi B, and the negative control and positive control. So the negative control should always show negative results, and the positive control should always show positive results. If the agglutination is observed in the O circle and the H antigen circle, it indicates the infection with Salmonella typhi. And if there is an agglutination which is observed in O and AH, it indicates infection with Salmonella paratyphi A. And if we observe agglutination in O and BH, it indicates the infection with Salmonella paratyphi B. So these are some of the recent news. Schools can impose checks. That is, schools are allowed to impose an approved health safety checklist to prevent an outbreak of communicable diseases such as typhoid amongst the students and teachers. So this was passed from the Fiji. And another important news where in August 13, 2022, watermelon suspected in Norway salmonella outbreak was resulted from the watermelon. Maybe these watermelons were grown in the fields, which was contaminated with the sewage containing the potent human pathogen salmonella. So this was a watermelon outbreak in Norway containing the salmonella and typhoid outbreak, with almost 20 people who were sick eating the melons. Was reported in 2022. That was about salmonella. Thank you.